Ischemic stroke. Causes, symptoms, diagnosis, treatment, pathology. Have you ever thought that in just 1 minute, your brain could lose nearly 2 million neurons? That number may sound unbelievable, but it is exactly what happens during a stroke. The frightening part is that it strikes without warning. It could be while you are having breakfast, chatting with your grandchildren, or even fast asleep. So if that moment happened to you, would you recognize it in time? People call stroke the silent thief of old age because it can steal everything in the blink of an eye. Your ability to walk, to speak, to remember, and sometimes even your independence as a person. But why is it that some people only experience tingling in their hand for a few minutes and then recover, while others are left bedridden for the rest of their lives? The answer is not just luck. It depends on whether you can recognize the early warning signs and whether you understand the hidden causes of stroke. More importantly, it depends on whether you are willing to make changes today to protect your precious brain. In just a few minutes, I will reveal secrets rarely spoken about, the hidden causes of stroke. You may be surprised to learn that even a familiar daily habit could silently push you toward disability. Can you guess what it might be? Did you know that there are 2 main types of stroke? One occurs when a blood vessel in the brain is blocked, called an ischemic stroke. The other is a hemorrhagic stroke, when a blood vessel ruptures and blood spills into the surrounding brain tissue. What's noteworthy is that ischemic strokes account for the vast majority, and they are also the leading cause of older adults losing the ability to care for themselves. Have you ever heard of a transient ischemic attack, when symptoms disappear within 24 hours, but which is actually the body's earliest warning signal? The danger is that most of us overlook it, thinking that a few minutes of numbness or slurred speech that goes away is nothing serious. But that very negligence may be the reason why, the next time, you won't get a chance to recover. So why does the body send out these signals, and how exactly does the brain suffer during a stroke? Before I explain further, I want you to pause for just a few seconds and ask yourself, if you or a loved one had a stroke right now, would you know what to do to save your brain? If your answer is not sure, then this is the moment you need to hit the subscribe button and press like so you don't miss any of these vital medical insights. You can also type 1 in the comments if you found this useful or 0 if not, so I know and can create even better videos for you. Up next, we are going to dive into a part very few people truly understand, the structure of the brain and why the blockage of just one blood vessel can change the course of your entire life. Are you curious to learn how your brain is nourished? Brain anatomy and blood circulation. Before we can understand why a stroke can steal away a person's ability to walk or speak in just seconds, we need to take a closer look at the brain itself. Did you know that our brain is divided into many regions, each functioning like its own control center? At the front lies the frontal lobe, which helps us make decisions and move our arms and legs. Next to it is the parietal lobe, which processes sensations and allows us to sense the body's position in space. If you've ever touched your nose with your eyes closed, it's thanks to this region at work. The temporal lobe is responsible for memory, hearing, and recognizing the voices of your loved ones. And at the very back sits the occipital lobe, where all the images you see each day are processed. Can you imagine what happens if any one of these brain regions is deprived of blood supply? Our brain is like a vast city, and blood is the highway system carrying oxygen and nutrients to every house. The 2 main highways are the carotid arteries and the vertebral arteries, which come together to form a special loop called the Circle of Willis. This loop acts like a traffic roundabout. When one route is blocked, blood can reroute through another path. But the question is, what happens when this backup system also becomes overloaded or suddenly blocked? In reality, the brain can adapt for a short period of time, but once the blood supply is interrupted beyond its tolerance, brain cells begin to die. That is when an ischemic stroke occurs. So what exactly causes these once healthy blood vessels to suddenly become blocked? The mechanism of ischemic stroke.
Have you ever heard someone say that our blood vessels are like roads and a stroke happens when a traffic accident blocks the flow? That's not far from the truth. But why are the brain's blood vessels so vulnerable to blockage? The first cause is atherosclerosis. Imagine that the inside of a healthy artery is smooth. But when damaged by smoking, high cholesterol, or high blood pressure, it becomes roughened. Fat, cholesterol, and immune cells then begin to build up into plaques, like clumps of sludge in a water pipe. At first, blood can still pass through, but over the years, the passage narrows. And do you know what's most dangerous? Not the large plaques, but the small, thin ones, because they rupture easily. When a plaque ruptures, its soft inner core comes into contact with the blood, instantly triggering a clot within minutes, cutting off the entire blood supply to the brain.
The second cause is embolism. This happens when a blood clot doesn't form inside the brain, but originates elsewhere, often in the heart. People with atrial fibrillation or heart attacks are at very high risk. A clot can travel through the bloodstream, take a wrong turn, and eventually lodge in a smaller artery in the brain. Just one small fragment is enough to silence the function of an entire region of the brain. There is also a particular condition known as lacunar stroke, common in those with long-standing high blood pressure or diabetes. In this case, the tiny arteries deep inside the brain harden and narrow, creating small lacunae, or holes in the brain tissue. Does this sound familiar? Many older adults complain of weakness and tremors without realizing these may actually be signs of this form of stroke. This raises a crucial question. Once the blood flow is blocked, what exactly happens inside each brain cell? And why is it that just a few minutes of delay can transform a healthy, independent person into someone permanently disabled? Pathophysiology of ischemic stroke. Have you ever wondered what really happens inside the brain when blood flow is suddenly cut off? Imagine the neurons as streetlights in a city. They need a constant power supply to shine, and blood is that power. When a vessel is blocked, the power is cut, and within minutes, the lights begin to go out. At the very center, the area most deprived of blood, the cells are almost certain to die. This is called the infarct core. But surrounding it is a buffer zone, where some blood still trickles in through nearby collateral vessels. This region is known as the penumbra, like the faint glow of light that remains. Can you picture it? This is the precious area doctors always try to save, because here there is still hope. Without oxygen, brain cells lose their energy. Sodium and calcium ions fall out of balance. Sodium drags water into the cell, swelling it like a balloon. Calcium is even more dangerous. It sets off a chain reaction that destroys mitochondria and rips apart cell membranes. The result is programmed cell death, with toxins spilling out and killing neighboring tissue. Isn't it frightening how the blockage of a single blood vessel can trigger such a devastating domino effect? And that's not all. After a few hours, immune cells rush in to clean up. But they accidentally make things worse, breaking down the blood-brain barrier and letting fluid leak in. The brain swells, but because the skull is a rigid box, there's no room to expand. The swelling pushes on critical structures, compressing the brainstem, the very center that controls breathing and heartbeat. That's why many stroke patients do not survive, even if the original clot was small. So the big question is, how can we recognize the warning signs in time to call for help before that precious penumbra disappears forever?
Symptoms and the fast roll. Do you know the most tragic thing about stroke? It's that so many people see the clear warning signs but dismiss them, thinking it's probably just fatigue. And just hours later, they lose the ability to walk or speak forever. So how can we recognize the danger in time? Doctors around the world recommend a simple method. The word FAST. F is for face. Ask your loved one to smile. If one side droops, that's a red flag. A is for arm. Ask them to raise both arms. If one drifts downward, be alarmed. S is for speech. Listen carefully. If their words are slurred, confused, or absent, it's an emergency. And T is for time. Every second counts. The faster you call emergency services, the greater the chance of saving the surviving brain tissue. But in reality, not every symptom is obvious. Sometimes it's just a fleeting numbness in the hand, blurred vision lasting a few minutes, or brief slurred speech that quickly clears up. Should we treat these faint signs as harmless, or are they in fact a warning of something much more serious? The important thing is that you don't need to change everything all at once. Just start with one small step. Skip a cigarette, add one extra plate of vegetables, or check your blood pressure regularly, and you've already taken a big leap toward protecting your brain. But above all, the most precious thing we need to preserve is not only our health, but also the belief that old age can still be joyful, strong, and full of happiness. So how can we turn fear into hope and transform old age into the most peaceful time of life? You see, stroke is truly frightening, but it is not a death sentence for aging. What matters is knowing how to recognize it early, calling emergency services in time, and, most importantly, taking preventive steps starting today. Simply by controlling blood pressure, lowering cholesterol, keeping blood sugar stable, and maintaining a healthy lifestyle, you can prevent up to 80% of strokes. Do you believe that just a few small changes can save an entire lifetime? Remember, every minute during a stroke is worth more than gold. When you see the signs of FAST, face drooping, arm weakness, slurred speech, do not hesitate. Call emergency services immediately, because the decision you make in those few minutes can mean the difference between walking normally again or spending the rest of your life in a wheelchair. Would you want yourself or your loved one to regret even a single moment of hesitation?
I want you to believe that old age does not equal illness or helplessness. On the contrary, it can be the time when you enjoy peace, play with your grandchildren, and live a life more meaningful than ever before. And it all begins with taking care of your health today. If you found this video helpful, please hit the like button, share it with your friends and family, because one day this small action could save their lives. Don't forget to subscribe and leave a comment below. Type 1 if you want me to share more tips on preventing stroke and heart disease, or type 0 if you feel you still need more basic knowledge first. Life after 60 can still be healthy, joyful, and full of hope. The question is, are you ready to start taking action today?